Hi, welcome to Autoimmunity Now with Dr. Carr. Today I'll discuss a paper which came out in 2017 where they looked at whether there was any influence of food on symptoms of rheumatoid arthritis. So as you know, rheumatoid arthritis is an autoimmune condition where your joints are destroyed because of an inflammatory autoimmune response. And it can lead to a lot of pain, joint deformities, difficulty in moving. And there are different therapies used for it. However, when you have reached out to any functional medicine doctor like me, most of the time we start off with food. And we know that food has a huge impact on on almost all autoimmune conditions. However, in traditional medicine, there is no specific diet that is recommended for rheumatoid arthritis. So, what does this paper say that I'm going to talk about today? So, this paper came out this is the title of the paper. So, Diet and Rheumatoid Arthritis Symptoms Survey Results from a Rheumatoid Arthritis Registry. So this is a registry of about 1,400 patients who have confirmed rheumatoid arthritis. And on this survey, about 217 of them responded. So this registry is from the Brigham and Women's Hospital in Boston, and they have had this for a while. So what they do basically is these are people with rheumatoid arthritis who are on regular monitoring. There are rheumatologists who are checking on them. They have blood work and everything done. So this survey was done because a lot of people have been saying, people with rheumatoid arthritis have been telling their doctors that food has an impact on their symptoms. So, who was included in the survey? So, 217 people responded. Most of them were women and Caucasian. And rheumatoid arthritis duration was an average of about 17 years. So, there were people who had rheumatoid arthritis from about 9 years to 27 years. And more than half of them were taking some kind of a disease modifying anti rheumatic drug. Now, if you have rheumatoid arthritis, you know what DMARD are. So, they are basically disease modifying anti rheumatic drugs. So, kind of a long sounding term, but DMARD is something probably you're very familiar with. So, what were the food included in the survey? So, they decided to include these 20 food, and these foods were based on the patients telling their doctors that there are some foods which people on the internet have been saying that these are anti-inflammatory food. So does it make a difference? So you can see on that list there are dairy containing food. Then there are a bunch of vegetables which are also called nightshade vegetables, if you're familiar with them: tomatoes, eggplant, bell peppers. Then, of course, there are soft drinks, beer, fish, then spinach, blueberries, strawberries, chocolate, red wine. Of course, there are soft drinks with sugar, caffeinated, decaffeinated coffee, tea. So, a lot of the food that people normally take, these were the ones included in the list. And what did they find out? So 24% of people on this survey reported that food affects their rheumatoid arthritis symptoms. So what they said is there was some food that made their symptoms worse and some food that made their symptoms better. So what were those foods? Obviously, you're interested in knowing whether those are the foods that affect you personally. So food that worsened symptoms in this group of people were soda with sugar, desserts, beer, diet soda, eggplant, and tomatoes. So you can see from that list, and if you have worked with me, you know that I always say sugar is your enemy. So if you have any kind of pain or inflammatory condition, sugar is definitely not your friend. And soda, of course, has its own whole host of other problems. So soda with sugar, desserts, again, something that contains sugar. Beer, again, is something that contains carbohydrates, which is indirectly sugar. And of course, diet soda doesn't contain sugar, but it does contain, other harmful stuff. So these are the stuff, the food basically I've been asking all of you to get off of. And when this particular paper, of course, surveyed only sugar intake, but many of you know that I've also told you things like honey, jaggery, they are also different, maple syrup. These are also different versions of sugar in some form or the other. So when you are looking at reducing your rheumatoid arthritis symptoms, it is much better to get rid of all kinds of sugar and sugar sweetened beverages as well. Anyway, going back to this particular survey, so you can see from that list, these were the food that affected them. Now, red meat, I'm going to describe a little bit in details on what would be included in red meat, though this paper did not specify clearly what was there in the red meat. But you can see that eggplant and tomatoes were also food that people felt it made their symptoms worse. And you know that in autoimmune diseases, we have something called the autoimmune protocol, which would include excluding sorry, that sounds awful. So, which means you also exclude certain vegetables, which are called the nightshade vegetables. And I will post more on food and its impact on autoimmune conditions on subsequent posts, but this is only on this particular survey. So, sugar sweetened beverages, sugar, desserts, beer, eggplant, diet soda, red meat, these were the ones that made it worse. So, this is from that list of 20 food that they were asked about. Now, obviously, you want to know what were the food that helped improve their symptoms. Spinach, strawberries, fish, blueberries. Now, strawberries and blueberries, berries have a whole lot of beneficial substances in them, which are polyphenols and a whole lot of clever sounding names. But the other important thing is both strawberries and blueberries are very low in sugar. Spinach, of course, is low in sugar. Fish. Now, fish, as many of you know, is a good source of omega-3 fatty acids. Of course, it would depend on what kind of fish you're having. So fatty fish would be a good one. So again, these are the food that we normally recommend you should increase your intake of. And again, of course, provided you do eat fish. Many of you don't eat fish. But spinach, strawberries, fish, and blueberries. Now, for some of you, finding blueberries in the off season may be a bit of a challenge, or it could be it comes from somewhere very far away. But this was done. This is a registry in the U.S. in Boston. So these were the things that people in that particular survey said that it helped them. But isn't it fascinating to see that though there is no specific rheumatoid arthritis diet, most of you have already figured out some of the food that bother you. Now, incidentally, on this particular survey, they hadn't specifically asked about gluten containing food. And as you know, I have written about gluten and non-celiac gluten sensitivity before. And if you have worked with me, you know that I talk a lot about getting off of gluten, and there are various reasons for it. However, this particular survey did not address gluten containing food specifically, but you can see a lot of these things can help you. So when it comes to red meat, so red meat includes, what are the meat included in red meat? Beef, goat, lamb, mutton, pork, veal, and venison. However, one important aspect that I want to stress upon is we know that processed meat is something that is quite harmful, and there are enough studies to tell us that. So what are the processed meat? Now you can see in that list, so processed meat is meat that has been preserved by adding preservatives, salting, or smoking. And I have talked about preservatives before and the harmful effect that it has on health. Specifically to autoimmunity, preservatives have been found to be associated with a higher risk for getting an autoimmune disease as well. So preservatives are all those chemicals that are added to food to make them more either palatable or have a longer shelf life. And I have talked to you numerous times about getting off of all kinds of processed food, and that would include processed meat as well. So this will include bacon, canned meats such as corned beef, deli meats such as salami, ham, luncheon meat, pate, sausages. So whether the red meat that these people reported, which were causing problems for them, were processed meat or unprocessed, that is a question that has not been addressed on that paper. So we don't know whether the meat that these people were taking, which they said affected their symptoms, they worsened their symptoms, whether it was just the meat the red meat as such, or was it the preserved meat, the processed ones? So processed meat would definitely make your symptoms worse. It is more inflammatory. It has a whole bunch of other harmful stuff in them. So I have talked about getting off of all kinds of processed food, not just meat. So even other processed food would contain extra salt, extra sugar. So processed food does have an impact. Now, interestingly, these people were also on medications. So most of them were on methotrexate, 54.8%, either alone or in combination. Many of them had tumor necrosis factor inhibitors. If you are on medications, you know the medications that I'm talking about. And I will not do a deep dive on medications because that is not my area of expertise. And one-fourth of these people were also on steroids. So obviously they had symptoms, though they were sort of stable, not like severely ill people, but at the same time they did have, and some of them had the condition for more than 20 years. So what kind of medication should you be on? That is a question for to be answered by your rheumatologist. And as I always say, whatever I say on these videos or on the blog post, none of that is to be taken as medical prescription. You need to work with your physician and decide upon what is the best policy for you. Now, the interesting thing is, the authors of this study thought that those people who were on DMARDs, that is medicines for rheumatoid arthritis, they would not show a huge response to the food, because some of the DMARDs are very potent medications. And if you have been on them, you know that some of you have got great relief from using these medications. And as you know, my personal opinion, I am not anti-medication or anti-anything. My point of view is always what helps you the most. And quite often it might be a combination of medications as well as lifestyle modification. It is not only medications that I rely upon. So though they thought that probably those patients of rheumatoid arthritis who were on these medications, they wouldn't have as much of a response. But to their surprise, they found that there was no difference in response to food based on the type of medication used. So there was no difference between those who were using methotrexate versus methotrexate and steroids versus methotrexate or a combination of any of the other medications. It didn't make a difference, which was quite a surprise to the authors of this study. The other interesting thing that I observed is what were the other medical conditions these people reported. And I have just made a list of 3 of them. They also had 6% had high blood pressure. They had heart disease. So the point is, when you have an autoimmune condition, your risks of developing cardiovascular disease, that is stroke, heart disease, are much higher. So that is the reason I have told many of you, we need to evaluate what is your risk for heart disease or stroke. So they had that as well. However, very interestingly, 33.5% of the people in this survey had acid reflux or GERD, or as some of you have described to me, you feel gassy, or you feel that burning sensation behind in the chest. 13.1% had lactose intolerance, and 11.5% had food allergy. This to me is very interesting because, as you know, we always talk about the gut playing a huge role in any autoimmune condition. So this was a very interesting finding from that survey. Then what were the other factors that helped them? And as you know, if you haven't downloaded that book that is there, the free ebook that is there on my website, where I talk about, what are the things that I use. So sleep, eat, move, mind-body interventions, and targeted supplementation. Now you can see on this list, so what were the things that helped them? Exercising regularly. 83.7% of the people who took part in that survey said it helps them. Now many of you are probably thinking, if you have severe pain, how are you going to exercise? So that is the point. You can do what you can do, and once your disease is managed better and you have less pain, you can definitely start off with mild exercises. And again, it's different things for different people. But do you notice how getting a good night's sleep impacts your symptoms? Many of you have probably already noticed that. But the people on this survey said 86.5% of people felt that getting a good night's sleep helped them a lot. Having a warmer room temperature. Now, you must remember that this was a survey in Massachusetts. So winter temperatures can be quite low there and summers can be high. So maintaining a warm room temperature helped them. And it will probably be different things for different people in different parts of the world. Some places in the world, where countries like India, it is very warm in summers. So how do you adjust your air conditioning to make you comfortable? That is very important. And the other interesting thing is your room temperature would also impact your sleep. Now, I know many of you are interested to know what were those vitamin mineral supplements that these people were on, which they felt 34% of them felt that it helped them. On the paper, they did not differentiate between the different supplements that these people were on. I have sent an email to the author, and if I do receive a response, I will add an addendum to this video, but they did not specify on this particular survey what were the supplements they were on. However, from other papers, we know that a lot of people with rheumatoid arthritis have found that omega-3 fatty acids, so fish oil supplements, have been very helpful for them because they are also anti-inflammatory. And another big one is vitamin D. So vitamin D is something that is very important to bear in mind. And I have a post on vitamin D on my blog, on my website. You can go through that if you want to know the details. So vitamin D and omega-3 are two of the big ones. Then, of course, there are a whole lot of other anti-inflammatory supplements like curcumin, bromelain, boswellia. And as you know, if you have worked with me, you know that I have talked about many of these. Whether you should use all of them, some of the time, that's entirely dependent on what is going on with each one of you. Some of you have benefited very well with just using omega-3 fatty acids and vitamin D. You did not need any more natural anti-inflammatories. Some of you have gotten off your medications completely, which is very exciting for me, and of course for you as well. And it's different things for different people. So the point I'm trying to make is, why not add multiple different things to help you and not depend only on medicines? How about focusing on getting a good night's sleep? Are you switching off that TV early enough? Or are you, watching that very stressful, I don't know what many of you watch, very stressful TV serial, which sets your brain all on hyperdrive? Or maybe are you watching some horrible news channel telling you that all about the gloom and doom in the world? So maybe you need to switch off the TV a little early and read a paper book. I've told many of you to do that. Switch your the lighted backlit device, whether it's your computer or a tablet. Switch it off for a paper book, or maybe get one of those e-readers which don't have a which is not backlit, because those things impact your sleep as well. So keep watching, and please feel free to sign up for my email updates that would have all the, maybe some link to an interesting paper that I read, or some video I've recorded, or some podcast where I've joined an associate, or any of that. And please keep your emails coming. Thank you very much. Many of you have sent very lovely, encouraging messages to me, and thank you very much. I really do appreciate that. So if you have any questions, feel free to email me. That is my email ID, info@drkarmd.com. And bye now, until the next video.